Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our series on hereditary angioedema, or HAE, a rare and potentially life-threatening condition caused by unpredictable swelling attacks that can involve the skin, gastrointestinal tract, or even airway. For many years, long-term prevention often meant frequent infusions. But today, allergists and immunologists have a wider set of targeted options that make prevention more practical and more individualized. So far in this series, I have covered FDA-approved injectable prophylaxis options, including biologic therapies such as Takhzyro and Andembry, and a RNA therapy such as Danzera. If you have not seen those episodes yet, you'll find the links in the description below. But today, our focus is Orladeyo, currently the only FDA-approved oral preventive therapy for HAE. With its most recent label expansion down to age 2 in 2025, Orladeyo offers a needle-free option from early childhood through adulthood. In this video, I will walk you through 5 key things you need to know about Orladeyo: what it is, how it works, how to take it, important warnings and dose adjustments, and what we know about safety. And if you're new here, don't forget to like, subscribe for more evidence-based medical updates. Now, let's dive in. First, what exactly is Orladeyo and who it's for? Orladeyo, also known by its generic name Berotralstat, is an oral plasma kallikrein inhibitor approved by the FDA for prophylaxis to prevent HAE attacks in adults and children 2 years of age and older. Unlike on-demand medicines used after swelling begins, Orladeyo is taken on a daily schedule to reduce the likelihood of attacks over time. It was first approved in December 2020 for patients 12 and older, and the indication expanded in December 2025 to include children as young as 2 years. For patients with frequent, severe, or disruptive attacks, effective prophylaxis can meaningfully reduce disease burden and improve quality of life. One critical reminder: Orladeyo is not a rescue medication. Its safety and effectiveness for treating acute HAE attacks have not been established, so it should not be used for acute treatment. Patients should still keep an on-demand rescue medication available for breakthrough attacks. Second, how does Orladeyo work? To answer that, we need to look at the kallikrein-bradykinin pathway, the core driver of swelling in hereditary angioedema. Under normal conditions, a protein called C1 inhibitor helps keep this pathway under control. In HAE, that control is lost because C1 inhibitor is either low or not functioning properly. When that brake falls, plasma kallikrein becomes overactive and cleaves high molecular weight kininogen, or HK, which leads to excess bradykinin production. Bradykinin is the key chemical behind HAE swelling. It makes blood vessels leaky, allowing fluid to shift into tissues, causing swelling in places like the face, extremities, abdomen, and in some cases, the throat. Orladeyo targets this process at the pivotal step. By inhibiting plasma kallikrein, it reduces downstream bradykinin generation and helps lower the baseline tendency for attacks to occur. In short, Orladeyo quiets the pathway that triggers swelling, so patients have a better chance of preventing attacks before they start. Third, let's talk about dosing and how to take Orladeyo. Orladeyo is taken orally once daily with food, and it comes in 2 formulations: capsules and oral pellets. For adults and children 12 years and older, the recommended dose is 150 mg as a capsule taken once daily with food. For children aged 2 to less than 12 years, Orladeyo is given as oral pellets in a single packet, with weight-based dosing ranging from 72 mg to 132 mg once a day. For children taking the pellets, a meal should be eaten just before or after dosing. A key technique point is that the oral pellets should not be chewed or crushed, because that can damage the film coating and cause a bitter taste. The pellets can be taken in one of two ways. Either pour the full packet directly into the mouth and swallow immediately with a non-acidic liquid like water or milk, or sprinkle the full packet over about 1 tablespoon of soft non-acidic food and consume immediately. The food should be at or below room temperature, and examples include pudding, mashed potatoes, cream corn, or pureed fruits and vegetables such as bananas, peas, or carrots. Acidic foods like yogurt or applesauce should be avoided because they can dissolve the coating and cause bitterness. The taste masking coating remains intact for 10 minutes. If the pellets are sprinkled over food and not consumed within that time window, the dose should be discarded. Fourth, let's review important warning and when dosing may need to be adjusted. The key safety warning with Orladeyo is the risk of QTc interval prolongation at higher than recommended doses. QTc is an ECG measurement related to heart rhythm, and in adults, QTc increases were observed at doses above 150 mg once daily in a concentration-dependent manner. Because QTc prolongation can lead to abnormal heartbeats, extra or higher doses should be avoided, and Orladeyo should only be taken once a day. Dose adjustments may also be needed in certain situations. In adults and pediatric patients 12 years and older with moderate or severe liver impairment, the recommended dose is 110 mg once daily with food. In pediatric patients 2 to less than 12 years with moderate or severe liver impairment, Orladeyo use should be avoided. In pediatric patients 2 to less than 12 years with severe kidney impairment, Orladeyo use should also be avoided. Drug interactions also matter. Orladeyo is a substrate of PGP and BCRP, which are drug transport proteins that help move medications in and out cells. Medications that induce PGP can lower Orladeyo levels and reduce its effectiveness, so those combinations should be avoided. Orladeyo can also increase exposure to other medications because it inhibits CYP2D6 and CYP3A4, two key liver enzymes responsible for metabolizing many commonly used drugs. And at higher doses, Orladeyo can affect PGP as well. For certain medications that are CYP2D6, CYP3A4, or PGP substrates, even small increases in drug concentration may lead to serious adverse reactions. In those situations, doctors may need to monitor closely or adjust the dose of the interacting medication. One additional example noted in the prescribing information involves certain birth control pills. When Orladeyo is used together with some hormonal contraceptives, it can increase hormone levels in the body, which may raise the risk of drug-related side effects. For this reason, the benefits and risks should be carefully weighed when these medications are used together. The practical takeaway is simple. Review your full medication list, including prescriptions, over-the-counter products, and supplements, and discuss with any liver or kidney issues with your healthcare provider so Orladeyo can be used safely. And finally, let's review side effects and safety. In clinical trials involving patients 12 years and older, the most common side effects were abdominal pain, vomiting, diarrhea, back pain, and heartburn due to acid reflux. Long-term safety data from an open-label study have remained consistent with the controlled trial experience. Gastrointestinal side effects, especially abdominal pain, vomiting, and diarrhea, were more common with the 150 mg dose compared with the 110 mg dose or placebo. These reactions generally occurred early after starting therapy, became less frequent over time, and typically self-resolved. In the studies, drug discontinuation due to gastrointestinal side effects was uncommon. However, if persistent gastrointestinal symptoms occurred in patients 12 and older, a dose reduction to 110 mg once daily may be considered. For children aged 2 to less than 12 with persistent gastrointestinal symptoms, clinicians should weigh the risks and benefits of continuing therapy. Less common side effects reported in studies included headache, fatigue, and flatulence, and post-marketing reports have also included nausea. Rarely, some patients experienced a brief itchy rash. In the clinical trial, significant increases in liver function tests occurred in one patient treated with Orladeyo 150 mg. The patient had no symptoms but discontinued the medication. No serious adverse reactions related to elevated liver enzymes were reported. In pediatric patients aged 2 to 11 years studied in an open-label trial, including a subset of children treated up to 48 weeks, no new safety signals were identified. And there you have it, 5 key things you need to know about Orladeyo, an oral plasma kallikrein inhibitor approved to prevent hereditary angioedema attacks in adults and children 2 years and older. With once daily oral administration, no need for injections or infusions, room temperature storage without refrigeration, and the flexibility to take it at home or while traveling, Orladeyo remains an important needle-free preventive option in modern HAE care. If you find this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.